30% of all data in the world are medical data, and the volume of medical data is growing by more than 30% each year. How do we make these dazzling amounts of data work to improve patient care? About 10% of the global population have chronic kidney disease. Most people are not aware because complaints start at a late stage. Therefore, timely detection is key, and kidney disease drives cardiovascular disease, making it the 5th cause of death worldwide by 2040. Now is the time to make a change. My research will develop new tests for better detection of kidney and heart disease. We measure thousands of signals in a single blood sample and use artificial intelligence to predict diseases more accurately than ever before. But the impact I reach for goes further. We need AI to be explainable, to understand the underlying processes, but also actionable, to identify kidney disease earlier, to develop new treatments and make data-driven decisions, to add healthy life years. My name is Martin de Borst and I'm a professor of medicine at the University Medical Center Groningen.